inflammatory gastroenteritis, right? We talked about cholera. We talked about E-tech and E-peg strains. We talked about Clostridium difficile and pseudomembranous colitis. And then we talked about vibriosis. Vibriosis can be really nasty, really, really nasty. Okay, so again, that Vibrio vulnificus, when people get sick, man, 1 in 2 people can die. So that's a terrible thing. All right, I'm going to try to record this here. I'm having problems with this WebEx, so bear with me for a second. All right.
I have a question.
So last time hello?
I have a question.
Yeah, go for it.
Have you ever tried Zoom? Because Zoom, a lot of my other teachers use it, and it works really good. And I'm just like asking, since you're having difficulties.
With just today, I think I'm doing something wrong or something else not programmed right. So I had a little problem earlier. Yeah, I have Zoom, but they want us to use WebEx. That's the preferred one here for Cal Baptist. This is the first time I'm having a problem like this. So if it happens again, for sure, I'm going to make a transition to Zoom. I think something got reset in my WebEx thing. So I'm not sure exactly what it is, but yeah. Anyway, we're here. All right. So if this creates a problem again, I will start using Zoom for sure. Yeah, I am hooked up with Zoom. All right, guys. So again, just to reiterate, last time, this is what we talked about, inflammatory gastroenteritis. We talked about several different organisms and the disease they cause. Today, we're going to finish up this lecture on enteric diseases. And I'm going to focus primarily on invasive gastroenteritis. Now, before we go anywhere, think about the term invasive. These organisms have a tendency to invade the mucosa and intestinal tract, so they can invade the intestinal lining. And of course, think about it. If the organism digs into the tissues, right, there's a chance for it to end up in the bloodstream. And again, we can have some very serious consequences. So I'm going to talk about a few diseases. These are the major ones. Typhoid fever, salmonellosis. I'm sure you heard about salmonella. Very different organism from salmonella typhi. This is the one that causes typhoid fever. But salmonellosis, it's other species of salmonella, not typhi. Typhi is a disease of the blood. Shigellosis, this is a really nasty organism. Very few cells can actually cause disease. And occasionally you hear on the news there's an E. coli outbreak. Well, this is the one that they're talking about. Not the E-tech strain. So you remember we talked about something called E-tech and E-peg. So again, this is a very different strain of E. coli. It's called 015787. Say a little about Campylobacter jejuni and listeriosis, especially as it relates to pregnant women and their fetuses. And then finally, yersiniosis, and then a really big one here. All right. This is Helicobacter pylori. So this is the organism that causes peptic ulcers or gastritis. All right, so I want to emphasize again, a good starting point for studying these tables, very, very significant. Again, it puts the disease into frame, names of organisms, the causative agent, signs and symptoms of disease, what types of toxins are involved, and of course, most of these will be transmitted to contaminated food and water. All right. I don't ask you too much about treatments, but again, I mentioned to you before, if there's a vaccine to protect you against these agents, I'd like you to know that. All right. Okay, let's go for the first one. The first disease is typhoid fever, and it involves a blood infection. All right. So when you say, well, Bideshi, why are we talking about intestinal infection and you talk about blood infection in the same breath? Well, here's the thing. These organisms you acquire through food and water. So it gets in the intestinal tract and then it slips into the bloodstream. So again, these are the critical things I want you to know. Names of organisms, disease they cause, symptoms. Well, most of them can have diarrhea, right? And then peculiar things that are associated with these bugs. And I'm going to point out a few for you today, all right? So the organism that causes typhoid fever, it's Salmonella typhi. So right over here, Salmonella typhi. It's a very nasty organism. There's a vaccine for it. In this country, we don't get the vaccine mainly because it's not a problem in the Western world. The common signs and symptoms. So typically people who eat food contaminated with Salmonella typhi or drink water that contains the organism gets into the intestinal tract, all right? Then it starts growing, and pretty soon it's invasive. It starts going through the intestinal mucosa, gets into the bloodstream. So people who have the blood infection now, so this is typhoid fever, they have a pretty high fever well within about a week or so after you see the initial symptoms. They have stomach pains, loss of appetite, so that's nothing new, constipation. These are all things that are related the enteric diseases. So that's just general stuff. But it's not unusual for people to be lethargic. They get tired easily and they become delirious. So again, here's the reason why. That temperature is pretty high, 40 degrees centigrade. That's pretty high temperature. And it doesn't last for one day. It lasts for several days. Now, here's some peculiar things I'd like you to know. About 30%, this is about 1 in 3 persons who have typhoid fever, they have these spots on their skin. Take a look at it right over here. Those are called rose spots. You can find them on the back, you can find them on the arm, you can find it on the chest. But that's not a peculiar thing, right? So again, if somebody, think about an examination question. Somebody has diarrhea, they have fever, they're delirious, right? Pretty high fever, and you see rose spots. Here's the key: rose spots on their skin. The very first thing that should come to your mind. Maybe I'm giving away a question on the exam, all right? But the first thing that should come into your mind is Salmonella typhi or typhoid fever. So keep that in mind. So again, I'm pointing out some really critical things that sometimes you can rely on to help you with your diagnosis. All right? Okay. Now, so those are the important things. Some people are carriers. About 3 to 5% of people who have typhoid fever, guess what? They can have that organism staying with them for a long time, even after they recover. So these individuals have Salmonella typhi in their system, right? But let me just say, they're not showing obvious signs of disease. At one point, they had that disease the first time around. They had diarrhea, they had a blood infection, they had delirium, they were pretty lethargic, they had spots on the skin. But here's what happens: their system adapted to that bacterium, or the bacterium adapted to their system, who knows why. And the bacteria cannot hang out in the gallbladder. All right, so it's hanging out in the gallbladder, and you guys probably know this, the gallbladder, it actually stores bile, and it secretes bile into the intestinal tract. Bile is required to help you with digestion. So every time you eat, what happens? Bile goes from the gallbladder to the intestines. And of course, what spills into the intestines, the bacteria, they're present in the gallbladder. So these individuals are carriers, and they serve as a source or a reservoir for infection for transmitting this disease from one person to the next. And think about it, they might go to the bathroom, never wash their hands. Perfect job would be a cook, right? So working in a restaurant, you don't want to think about these things, but it happens. And then they didn't wash their hands. Well, they have bacteria all over the place. And now you can transmit that to food. You know, after we go through these discussions on bacterial disease, you might not want to eat outside anymore. But, you know, pretty much the food stuff is pretty safe here in this country. I got to tell you that, all right? So let me just summarize this slide for you. Typhoid fever is a disease of the blood. Yeah, it starts in the intestinal tract because you drink food and water contaminated with the organism. The organism digs into your system, gets into the bloodstream, so now you have a blood infection. Causes a pretty high fever. Think about the term typhoid fever, pretty high fever. So people, they become lethargic, tired, they're delirious, right? So those are some important conditions that you see. And then, of course, about a third of all cases, these individuals have spots on their skin. Those spots have a very special term. They're bright red. We call them rose spots, all right? About 5% are carriers. This is not for you, so don't worry about that. Now, how do we get typhoid fever? Again, it's pretty obvious. You get it from food and water, right? So many different things can contaminate food. Picture a fly. So these are the 5 F's, as we call them, all right? This fly is flying around. Maybe that fly sat on some poop that contains Salmonella typhi. And then it flew and contaminated meat. So it transmitted that bacteria on its legs to the foodstuff. And of course, now you eat that, you get disease. So flies, food, fingers, all right? People, they touch maybe contaminated objects, and they use that to manipulate food or make food, or whatever. You just contaminated this. Feces, or the bacteria present in feces too. Think about the carriers I just mentioned. Now, we saw this term before, fomites. Fomites are inanimate objects. Think about a door handle, think about a cup. Think about just touching surfaces, inanimate. So in other words, they're not life forms, all right? Now again, here's a nice little history. This goes back to about 100 years ago of a lady who was a carrier. She had typhoid fever, and then she carried the bacteria in her gallbladder for a long time. I'm not going to read this here for you, but nonetheless, she had a perfect job. She worked for restaurants. She was a maid. She cooked for families. And of course, a lot of people became infected. and they had disease, typhoid fever, because of her. All right, so the carrier state is pretty important because those individuals, they serve as a reservoir for that organism. All right, so for the others, I'm just going to say a few things about them. There's not too much detail about them. Again, when I see something very specific, I say, remember this little phrase or this little terminology. It's very important. Now, salmonella. So other salmonella species, not salmonella typhi, that causes typhoid fever. But other salmonella species like salmonella typhimurium, salmonella enteritidis, salmonella newporti, these are different species or serotypes. They also cause disease. So typically when you hear, here's a salmonella outbreak, it's not typhoid fever. It's this type of infection that we're looking at. Now, importantly, a large dose of bacteria are required to cause disease. Why? Imagine you're eating, let's just say meat or something, there's tons of malaria, and there's tons of salmonella in there. Let's just say there's 100 million cells. When you eat, that stuff goes to the stomach. The stomach is pretty acidic. Most of the organisms die in the stomach, all right? So you require a very large dose. Typically, to cause disease, you have to have about 100,000 to about 200,000 cells in the intestinal tract. And again, we see the same old symptoms: diarrhea, maybe some cramps, sometimes vomiting. All right, so these are all associated with the disease, but that's not very specific, very general. All right, okay. Now, this other organism, I'm going to say a little more about. So shigellosis. This is a really nasty group of organisms. 4 different species: dysentery, boidy, flexneri, and soni. So sonii, this is present in this country. Most of the cases are of this type. The others are present also. The most dangerous is this one here, Shigella dysentery. All right, so let me just say a few things about this organism, or these organisms. Basically, here's the few things I want you to remember, right? Very few cells are required to cause disease. Take a look at this. Just about 10 to 200 cells can cause disease. That's unlike salmonella, we just talked about that one. You require about 200,000 cells. So this is a very virulent organism, all right? Now, the organism produces a toxin. It's called a Shiga toxin. So there are different types, of different variations of this Shiga toxin because we have different species. But that toxin prevents protein synthesis, and that toxin triggers stomach enteritis, inflammation of the intestinal tract. All right? So, terminologies. Diarrhea, simply what that means is excessive loss of fluid, right? Then we have something called dysentery, like Shigella dysenteriae causes dysentery. What dysentery is, it's a little different from diarrhea. Yeah, you have diarrhea going on, but you also have waves of intestinal cramps, abdominal cramps. You have passage of blood. You have liquid stool that's being passed. You have blood and mucus in the stool. So all of those things are associated with diarrhea, with dysentery. So again, a simple terminology: diarrhea is just excessive loss of fluid to the intestinal tract. Dysentery is a little different thing. Yes, you have diarrhea, but you also have mucoid and bloody stools. All right? Now, moving on. There's another E. coli strain, and this is a really bad one. So, yeah, we talked about enterotoxigenic E. coli. So you guys remember ETEC, right? And I said the way you remember the disease it causes traveler's diarrhea. So T and travelers. So you guys remember that one, right? Then we talked about EPEC, enteropathogenic E. coli. The way you remember that one is P is for pediatric patients. So hopefully you remember that one. Are those two? There's another strain of E. coli. It's called EHEC. All right? So this stands for enterohemorrhagic. H is for hemorrhagic, bleeding. So that's a very different one from ETEC and EPEC. So EHEC is called enterohemorrhagic E. coli. It causes enterohemorrhagic colitis. So there's inflammation of the colon. There is a bleeding that can occur there also. So that's one thing I want you to remember. What's unique about this strain of E. coli? It produces a Shiga-like toxin. We just talked about Shigella, right? Shigella produces that toxin called a Shiga toxin. Well, here's an E. coli strain. It produces a toxin that resembles a Shigella toxin. So it's very nasty. So this is a Shiga-like toxin-producing strain. So again, EHEC, right, produces a Shiga-like toxin. It's classified as an S-TEC strain. So S-TEC simply means this: Shiga toxin producing E. coli. So this is where it gets a little confusing. All right, so let me go through that again one more time. We talked about ETEC and EPEC. So that was before, that was last lecture. ETEC is enterotoxigenic E. coli, causes traveler's diarrhea, TNT, right? Then we talked about EPEC, enteropathogenic E. coli, that causes disease primarily in pediatric patients. Here's another strain of E. coli, it's called EHEC. That stands for enterohemorrhagic E. coli. So hemorrhaging means bleeding. Colitis means inflammation of the colon, or the large intestine. This strain of E. coli is very different from the ones we talked about before. Why? Because it produces a Shiga-like toxin. This is like what Shigella does. And these strains that produce Shiga-like toxins, they're classified as STEC strains. So STEC simply means Shiga toxin producing E. coli. So EHEC, it's a type of STEC strain. Hopefully you get that link. All right. Now, a couple other things I want to point to you, and you should know it pretty well. First of all, there's a name for this E. coli strain. Yes, it's EHEC, but a more specific terminology is this one here. Don't forget it. It's E. coli 0157H7. That's a strain of E. coli that is the EHEC strain. So again, typically when you hear about E. coli outbreaks, and you can get this infection from bacteria in food, vegetables, water, a bunch of different sources, it's this strain here. So it's E. coli 0157H7. Now, the last thing I want to say about this strain, it can cause a really miserable problem, especially in kids under 5 years old. And that condition is called hemolytic uremic syndrome, or HUS. So don't forget that. HUS. EHEC 0157H7, STEC strain, it's all the same. This disease, what happens, the bacteria gets into the blood, and again, first of all, you have bloody diarrhea to begin with. The organism can slip into the bloodstream, and especially in younger people, it can cause major problems. Fever, lethargy, they become tired, vomiting, diarrhea. And at some point, it can affect the kidneys, all right? So when this occurs, of course, toxins are building up in the bloodstream. The kidneys filter blood, so it removes toxins. In this case, with the HUS strain, or this HUS disease, hemolytic uremic syndrome caused by EHEC, this could be a problem. About 3 to 5% of kids who have this disease, they die. Now, that's a high death rate for an enteric disease, all right? So let me summarize the slide. EHEC, enterohemorrhagic E. coli. It's a type of STEC strain. I know. STEC stands for Shiga toxin producing E. coli. This strain is also called E. coli 0157H7. Don't forget that. That's really important. You're going to see this in your practice as a nurse lots of times. In kids, especially kids under 5 years old, there's a very special type of condition that occurs. It's called hemolytic. All right. So you're destroying red blood cells. Uremic syndrome. In this case, people can have seizures, they can have skin rashes, they can have low urine output because the kidneys can be affected. You have low blood volume. All this stuff goes together to produce a really nasty disease. All right? Don't worry about more things about STEC strain. That's not for you. Here you can read. This is just for your reading. I just want you to name the organisms, disease they cause, what's peculiar about that disease, are there vaccines for it, and specific things I mentioned. All right. There's another case for you, and I'm not going to read this here. It's about an E. coli outbreak, an EHEC outbreak in 1996. Very bad one. All right. Now, moving on that list on the table of bacteria, is the organism that causes a disease called campylobacteriosis. That organism is Campylobacter jejuni, right over here. This is the name of the organism. All right. This organism is present in chickens and turkeys, meat in general. In fact, if you go to the grocery and you buy a fresh turkey, right, or fresh chicken, you can actually isolate this organism. That tells you something. If you cook your food well, right, you're unlikely to get disease. So that's an important fact I want to bring up. So many of these pathogens that we're talking about, guess what? They're present on the meat that you buy in the grocery. You just have to look for it. Maybe very low numbers. But again, there's a potential to cause disease if you don't cook your meat properly. So every year there's about 2.5 million cases. Most cases, but this is an estimate. Most cases are undetectable because typically people have mild symptoms. They get over this in a couple of days. But in some individuals, this can cause what we call explosive diarrhea, and you can have a serious infection. There's a link to another disease. It's called Guillain-Barré syndrome. This is where we don't understand why this occurs. This is where you can have basically a transient or maybe a lifelong paralysis. You start destroying the nerves. It's probably an autoimmune disease. It's pretty rare. Many different diseases are linked to this. We really can't explain why, but again, most people think it's an autoimmune disease, but you start destroying your own nerves. All right? Okay, so I mentioned explosive diarrhea in people who have severe conditions. This is a problem that you see in these individuals, but most people recover fairly well. Okay, the other organism is Listeria. In fact, it's Listeria monocytogenes, right over here. All right, this disease causes Listeria, this bacteria causes a disease called listeriosis. Now, I do want to point out one thing. It's a gram-positive rod, right over here. All right. So far, most of the organisms we have been talking about is gram-negative rods. Salmonella, Shigella, E. coli, they're all gram-negative rods. This one is a gram-positive rod. Notice it's a psychrophile. You guys know what that means. A psychrophilic organism can grow in low temperatures. So this organism can grow in cheese, it can grow in milk. What I want to point out to you, it's a major cause of what we call bacterial meningitis, especially in kids, right? And it causes septicemia, the organism you acquire through food and water, and then the organism penetrates through the intestinal mucosa, gets into the bloodstream. So that's a huge problem. It loves to cause meningitis, so that's one thing I'd like you to know. But think about this. Here's a pregnant woman. She has listeria, and that organism can actually move through the placenta to get to the fetus. When that happens, that's a very, very dangerous condition. So I'll just show you an example. Here's a baby who's born with listeriosis. Of course, this is a stillbirth. This baby died in the second trimester. Why? It's because that bacteria moved through the placenta just by chance. This pregnant woman got Listeria monocytogenes in her blood. Organism moved through the placenta, got into fetal circulation, and you have major damage and death here. Even when babies are born and they have Listeria in utero, all right, they have some major consequences associated with it. Poor brain function, poor liver, poor heart function. Basically, the organism can cause a havoc on those individuals. It's a very deadly organism. Once it gets in the bloodstream, people do recover. We have antibiotics to help us take care of this problem. But again, the biggest problem I want to alert you here is pregnant women and their fetuses. Let me show you how deadly this is. Back in 2011, that's a long time ago. And of course, occasionally, even now, we see a few cases of listeria. This case was linked to cantaloupes. So here's a farm. I think for whatever reason, their cantaloupes were basically contaminated with listeria. This farm sent cantaloupes to 28 states in the United States. Out of this, 140 cases of listeriosis and 30 people died. All right, it's like 20% or so. That's significant. Look at influenza, 0.002% of people die. That's typical for influenza. But when you have something like this where 20% of the people die because of an infection, tells you something. This is a very virulent organism. All right? Now we're winding down. Next on the list is Yersinia or yersiniosis, caused by Yersinia enterocolitica. Now, later on, we're going to see a name of another organism. It's called Yersinia pestis. That organism is very virulent. It causes the black plague or bubonic plague. But that's not what we're talking about here. We're talking about Yersinia enterocolitica. It is like Listeria. It is a psychrophile. So hopefully you remember that term. A psychrophile is an organism that can grow at low temperatures. Now, your body temperature is 37 degrees. Your freezer is minus 20 degrees centigrade. All right? Your refrigerator, of course, things don't freeze in the refrigerator. That's about 4 to 8 degrees centigrade. That's pretty cool. Well, psychrophiles like Yersinia and like Listeria, they can grow at this temperature. That tells you a whole lot. You put your milk in the refrigerator. You put fluids and other things in the refrigerator, right? If by chance you happen to have Listeria or this one, Yersinia enterocolitica, those organisms can grow. Imagine you have contaminated milk with Listeria or Yersinia. It grows, and you drink that stuff, and now you have a disease. With Listeria, that's a severe disease. With Yersinia, most people recover. Let me just say it can be severe, but you have to look at the population. Very young, very old, immunocompromised. But we rarely see, compared to Salmonella and Shigella, we rarely see Yersinia enterocolitic causing disease in humans. Very few cases. All right? I have two more organisms on the list, and I'm going to spend a little time on this one here. Okay? So I'm going to talk about an organism called Helicobacter pylori. It's the primary cause of gastric ulcers. Gastric refers to the stomach, not the intestinal tract. All right? It's also called peptic ulcers. Now, for the longest time, people thought this, and this is true too. Basically, the reason why people have ulcers in the stomach is because stomach acids degrade the tissues. But years ago, a few people actually suspected, two individuals in particular in Australia said, you know what, maybe bacteria can cause this disease. So here's the disease I'm looking at, all right? This is the stomach. This is endoscopy. So you're taking a little video of the stomach back here, or little pictures of the stomach. You see all over here? That's inflamed, all right? These are peptic ulcers. Very, very dangerous. By the way, this organism is linked to cancer also. This is the only bacteria known to be linked to cancers, to causing cancers in the stomach. So the question is, what actually caused this? Well, in the past, many people actually thought what caused this is acids in the stomach. There's less mucus, the acids get access to the tissues, you start destroying the stomach. You create these ulcers in the stomach. That's true, that does happen, but most of these cases are actually linked to a bacterium. And this bacterium is Helicobacter pylori, causes gastric ulcers or peptic ulcers. Many people are actually affected by this problem. So I want to talk about this disease in a bit. All right. So here's what I'd like you to remember. Most organisms that go to the stomach, they die. It's too acidic. I mean, the acids in the stomach rip them apart. This one can be ripped apart by acids in the stomach also, but it's devised a little strategy. All right, so why does this organism infect the stomach when most organisms die because of the high acid content in the stomach? Here's why. The organism, and don't forget this one here, okay? That organism produces a ton of an enzyme called urease, right over here. Underline that. So this organism produces urease. So what does that mean? Well, we have to look at the function of urease. Urease does this. When you metabolize, you produce urea. So this is what you do normally. You're producing a lot of urea. This enzyme comes by and breaks urea down into ammonia and then carbon dioxide, all right? So first, we're going to look at carbon dioxide in a second, but let's focus on ammonia. Ammonia is a base, all right? It's alkali. Your stomach is acidic. So I have, let's say, H pluses here. That's acid. When this organism does this, it converts urea to carbon dioxide and ammonia. Let's just say this bacteria is right over here, all right? In this local environment, you just neutralize the pH. So it's not acidic in that specific environment. That gives this organism enough time to actually slip into stomach tissue, all right? So now it's here. It's going to start replicating over time. So you have a chronic disease now. And at some point, what happens, you have so much organisms and so much toxins, cytotoxins included, that you cause an ulcer at that site. All right? So the trick this organism utilizes is this. It produces an enzyme, big time, not just a little bit, a ton of it. It's called urease. Urease converts urea to carbon dioxide and then ammonia. All right. So how do we detect this organism? It's in the stomach. Well, there are a couple of things you can do. In fact, there are three things I want you to know. First of all, we can culture the organism. You just grow it in a laboratory. That's one thing. The second thing, you can do a breath test. All right, so let me just describe this test to you. You guys probably know this. If someone's been driving drunk, stop by the cop take a little instrument out, and it measures alcohol level. That's a breath test. All right? We can do the same thing for people who have this condition, or just a screen for whether or not this organism is present there. It goes back to this reaction. Urea in the presence of urease would give you carbon dioxide and ammonia. We're focusing on carbon dioxide. So this test actually detects carbon dioxide, but there's carbon dioxide in the air. So how can you distinguish normal carbon dioxide from this carbon dioxide that's produced by urease? So here's what happens. you actually give this person something to drink. That something is urea, but it's radio labeled. That carbon is carbon 12, not carbon 13. So this is labeled in urea right over here. When the person drinks this solution, literally the organism is present there. Its urease is going to convert urea to ammonia, all right, but carbon dioxide. But this carbon dioxide is labeled. It's radioactively labeled. When you breathe this out, actually, what happens? This carbon dioxide gets back into your system, gets to the bloodstream, gets to the lung, and you breathe it out. Well, you can detect carbon dioxide, C12, carbon dioxide right over here, all right? So this test, the breath test, is looking for radio label, that's C12, carbon dioxide, okay? Now, this last test is like this. You take an endoscope, so a little camera in this little tube, you go to the stomach, and here's an area where you have a lesion, all right? That's where you have an ulcer. You can do a biopsy. Basically, you cut a little piece of that tissue, and you bring it back up, and you put it into these little tubes. So this is what the tube looks like to begin with. If the bacteria is present, it's going to convert, this tube has urea. It's going to convert urea to ammonia and carbon dioxide. This becomes pretty basic. So there's an indicator dye in the tube. If I have ammonia, it converts the color of the dye from yellow to red. And this happens in about a few hours, by the way. You don't have to wait 2 days for this. This happens pretty readily. So 3 different tests. One is called a breath test. We can do a bacterial culture, and then we can do a biopsy and actually look to see if this organism is there by putting this in this tube. It's called a rapid urease test, all right? It has an indicator there. If it's a normal or neutral pH, it's yellow. If it's basic, which ammonia is, it now becomes red. All right, so a lot of people didn't actually believe this bacteria caused that disease. So 2 individuals in Australia, Marshall and Warren, all right, they said, you know what, maybe most cases of peptic ulcers is due to those bacteria. So they published their paper. Many people didn't believe them. So Marshall actually said, you know what, I'm going to do an experiment on myself. So he took the bacteria he isolated from those ulcers, made a suspension, and drank it. He really, literally did. And of course, he didn't come down with disease initially, but ultimately he did. They actually showed that this organism causes peptic ulcers. Again, acids can do this. Take a look how nasty this looks. This isn't the stomach, guys. All right, this is what that bacteria does. This bacterium, Helicobacter pylori. That's what it does. Anyway, for his experiment on himself, both of these guys got the Nobel Prize. They actually proved that this organism caused that disease. And there's a whole write-up on it, all right? So you can read this on your own. All right, here, okay? Tells you the story about that organism and this disease. Now, last on the list is brucellosis. So brucellosis is very rare in the United States. The reason why is because we take care of our farm animals pretty well. This bacterium, there are many different species, but the most significant one is this. Think about the term Brucella abortus. It causes spontaneous abortions or abortions in cattle. But think about it, this happens in humans also, all right? Good thing it's pretty rare. These bacteria can be found on animals, farm animals, cows included, all right? So it's not unusual to have cow meat, beef contaminated with Brucella abortus, or milk contaminated with Brucella abortus. That's why it's so important to pasteurize milk. You're more likely to have these organisms and others in unpasteurized milk. And pasteurization is a very simple process. You just expose milk, not at boiling temperatures, but about 65 degrees for about 5 minutes. All right, you kill the microorganism. In any case, the disease this organism causes, and again, it's very rare in the United States, is called undulant fever. All right, undulant fever. People have sweats and chills and sweat. You have these undulant up and down. That's what that means. Or back and forth, all right? You have these fevers that occur, high fever with sweating in the daytime, and low fever with chills in the evening. So you have this up and down episodes of fever and chills. People can resolve this on their own. In other words, no treatment might be required. But in severe cases, of course, antibiotics can take care of this problem right away, all right? So again, what I want you to know about brucellosis causes undulant fever. Fever, chills, fever, chills, fever, chills. This bacterium is present in farm animals like cattle, like goats. For example, the one that infects goats is called melitensis. The ones that infect pigs, Brucella suis. Even in dogs, the one that infects dogs is Brucella canis. All right. Okay, guys, so we've just let me just say one more thing. I'm not going to talk about this disease here. Anthrax. You guys hear about anthrax a lot. There are 3 different types of anthrax. First of all, inhalation. This is a respiratory disease. And we talked about this one earlier. I said, guys, don't worry about this yet. We're going to talk about this in chapter 13. All right. There are 3 forms of anthrax. Inhalation, that's the most deadly form. Then we have intestinal. This is what we're looking at here. You just eat food or drink water that contains the spores of this bacterium, Bacillus anthracis. You can get intestinal anthrax. And the third is the most common. This is cutaneous anthrax, infection on the skin. All right, that's the least deadly form, but it's the most common form. So I'm not going to talk about anthrax here. Chapter 13, which is the next chapter we're going to start on Monday. All right. We talk about anthrax. We talk about the toxins. We talked about the 3 different forms: intestinal, inhalation, and cutaneous anthrax. So this would not be covered on the exam on Wednesday. All right. Okay, guys. So that's the lecture for today. We've just completed chapter 12. Sorry about the little delay back here. This is an issue I was just having today for some reason earlier, and then to this class. But we're cool now. I think we're gonna resolve this problem. If this doesn't work, we're going to try Zoom. But again, I don't want to go there yet. All right. It's probably my fault. I probably did something to the program. I don't know what it is, but we're going to figure it out. Okay, so a few comments before I have you guys ask questions, if you have any. To remind you, we have a quiz. Somebody requested a quiz on Monday. So I did decide to do that. This will be your 4th quiz. And I think this is the 5th week of classes. So we're doing pretty good with quizzes. All I need is 6 good quizzes. So I'm pretty sure we're going to have at least, check this out, at least 8. I'm shooting for 10. I don't know how that's going to happen, but at least we have 8 quizzes. If you've taken all of them, you get to drop 2. So quiz number 4 will be on Monday. All right. I've extended the time so we don't have this issue with people logging on late. So I give you 10 minutes before and 10 minutes after. So basically, your class starts at 2:30. At 2:20, you can log on, which I really suggest that you log on really early. But the latest you can would be 2:40. The reason why is because I need my lecture time. So again, that gives you a lot of time to finish that quiz. It's only 10 minutes, all right? And then on Wednesday, we have exam 2. 2 chapters only. Your study guides are your slides. Hopefully you've been taking notes, checking things off. What I'm interested again. So this is like the 50th time I said this, right? Names of organisms, disease they cause, signs and symptoms. And if something's peculiar about them, you should know that, like a toxin that we talked about, like botulism toxin, like rose spots on the skin for typhoid fever. Those are the things I want you to know. Flaccid paralysis, again, for botulism. All right? So that's going to be next Wednesday. All right, so I'm going to shut up and answer any questions you might have. And if you're fine, no problem. You can log off. I already have your attendance. So don't feel bad because you're logging off. I'm not taking notes of that. All right? But do you guys have any questions you'd like me to address?
Somebody typed in a question in chat.
All right. Can you just read that question for me?
The question says, it's from Nicholas Jabonero. I think that's how you pronounce their name. I do have a question on chapter 12's objectives. I'm not sure how to answer B, C, L, and M. Okay, so if you've been paying attention to my lecture, here's what for all of those organisms we talked about, it doesn't matter which one they are. So you should know the names of the organisms, disease they cause, signs and symptoms, and peculiar things I've said to you. So that's all I'm going to test you on, really. All right. So if you look at the objectives, B. All right. So basically, did you say B? Was that on there? Yes.
All right. So molecular mechanisms. So we did talk about a few of these. Remember, we talked about botulism. Well, what does the botulism toxin do? it prevents release of acetylcholine. So people end up with flaccid paralysis. We talked about the Vibrio toxin. Remember what that cholera toxin, Vibrio cholera toxin does? The receptor is the GM1 ganglioside. It literally, basically, it reverses the flow of ions. So ions move into the intestinal tract. So you have a huge loss of water into the intestinal tract. People end up with massive diarrhea. All right. Okay, so which was the other one?
The other one was C.
Okay, C. All right. So again, we talked about, so what is gingivitis? Inflammation of the gum, right? So what happens there? You have plaque buildup. Organisms can be in there also. They can occupy those niches. And again, from there, they can spread to the bloodstream to cause endocarditis. All right. I can't, it's too small for me to actually see this. So can you read the other letter?
The next two letters are L and M.
All right. Okay, so this one, and I'm glad you brought that up. All right, so remember, I only care about the organism we've talked about. So we talked about Vibrio vulnificus. So again, remember, so we talked about vibriosis. That's Vibrio vulnificus, Vibrio parahemolycus. These organisms you find in seawater. So when people get infected, when they get disease, it's because they consume contaminated fish or seafood. This one here in particular is very, very dangerous. If you recall, I have about 100 cases per year. The death rate is 50%. That's 1 in 2. Parahemolyticus, about 4,500 cases per year. Not as significant. Don't worry about these two other organisms. People are still debating whether or not they are pathogenic. But we did talk about this one, right? Clostridium difficile. Remember, we talked about something called pseudomembranous colitis. So that's an important one. All right, and the last one would be M. So I do have the antibiotics listed for you, but I was careful to tell you this. What I really care about is not that you can memorize the antibiotics that we can treat. So I've said this several times in the class, don't worry about that. I have to mention them. So they have to be in the objectives, but they're in those tables also. Here's the reason why I don't have you guys memorize those, because that can change. So imagine you just struggle to memorize all these different antibiotics for specific diseases, and when you start your practice, you're thinking certain things. It's not so anymore, because bacteria can develop resistance. So don't waste time, as I mentioned a few times in the lectures, doing that. I do want you to know there's a vaccine, like DPT, right? So we talked about that earlier. For typhoid fever, there's a vaccine for it, but don't memorize antibiotics unless I say, hey, specifically memorize this one for that disease. Are we good?
Yes.
All right, nice. So if you stick with what the protocol, with what I've said, I'm going to repeat it again, right? So what am I going to test you on? Well, think about this. You're a nurse. Patients are coming to you. What's your primary concern? Is that you can recognize diseases, all right? So the names of the organisms, diseases they cause, signs and symptoms. I mean, fever you're going to find for everything, right? But a high fever is pretty important, like for typhoid fever. Then what else? Peculiar things like rose spots, like spots on the skin for meningococcal meningitis, like colitis, like inflammation of the colon, like pseudomembranous colitis. Those are very specific things associated with specific organisms. So those are the major things I will test you on. Don't memorize antibiotics. I haven't listed any of those for you yet. Are we good?
Yes.
All right, nice. Other questions?
I had a question.
Yeah, go for it.
Can you explain again about urease? Because you said, because I know we have like acids in our stomach that break down and kill a lot of bacteria, but
Yeah.
one bacteria, the Helicobacteria pylori,
Yeah.
that is that still has a strategy of making it
Yes.
worse, infecting the body. Can you explain that again, please?
Yeah, sure. I'm glad you asked that question. All right. Okay. So let me just repeat a few things that you said. Most organisms run through the stomach, bacteria, they just die because it's too acidic, right? So that's one thing. To survive in the stomach is a very, very lethal thing. It's very difficult. But if you can devise a strategy like this organism has, then you can just basically you can bide your time and then invade the stomach tissue. So what is this strategy that this organism has? Now, first of all, if the organism didn't produce urease, it will die in the stomach. All right, so keep that in mind. But the organism does produce urease. So here's how it works. So I want you to follow this all the way through. Somebody, let's just say this person drinks some water, all right? And this water has tons of that organism, Helicobacter pylori, all right? This organism gets to the stomach, and let's just say I have 200 million cells. Let's just say 199 million cells die because of the acids. Well, the other ones that are surviving, they can have the capability to do this. They're going to produce this enzyme. So this is from the bacteria. That enzyme is called urease. So why is that so significant? Well, this is the trick this organism uses. Urease is an enzyme that takes your urea. You have urea floating around in fluid and blood and tissue fluid, and it converts it to ammonia and carbon dioxide. Now, the key here is ammonia. Ammonia is a base. All right, so we have a base, a very strong base. The stomach is acidic. All right, so when the organism produces base in the acidic environment, the pH now becomes, let's just say pH 7. It's not really 7, but it's neutral now. The bacteria can survive in this local area. See what's going to happen? It's pretty acidic all around, but in this specific area, the pH is kind of neutral. That gives the organism a little time to invade tissues. So once it gets inside the tissues, the stomach tissue, like right here, it doesn't matter anymore because the organism is not exposed to acids anymore. And it can grow to produce ulcers. It can also be linked, it's linked to cancer directly, cancer to the stomach. So again, it's a pretty important strategy. Hopefully that makes sense to you. Are we good?
Yeah, that helped. Thank you. So the base is the reason why the acid is like getting neutralized, or
Exactly.
not? Okay.
That's right, because ammonia is a base. It's going to neutralize the acid in that local environment.
Okay, thank you.
All right.
I have a question.
Go for it.
I'm a little confused because you know how you said that botulism like something that is associated with it is flaccid paralysis.
Yeah.
And then we talked about spasms and limb spasms and head spasms after that. Is that caused by botulism as well?
No, in fact, you can use the toxin to treat diseases like that. So let's just go back to that slide. All right.
Oh, okay.
All right. So here we go. So what happens, of course, in fact, let me just review a few things because this is really important. So when somebody has botulism, here's what's happening. All right. Normally, let's just say without botulism, here's what's happening. For your skeletal muscle to contract, so forget about that disease, right? This is just normal. I'm moving my arm. Here's the reason why I'm moving my arm. Your neurons release acetylcholine. Acetylcholine stimulates your skeletal muscle to contract. And we're not going to go through the mechanism here, but that's what happens. The botulism toxin prevents this from occurring. So there's no release of acetylcholine, so therefore your muscles can't contract. You end up with limpness or flaccid. Flaccid means loose. You can't contract, no spasm, right? Flaccid paralysis. So this is what the toxins do. Now, what you're asking, again, by the way, these are examples. All of these people, you don't see them in a movie or something, right? On a video, you can tell this face is expressionless. They can't move their muscles. Flaccid paralysis. Here's a baby just limp. I mean, can't even move the arm or the legs, right? You don't expect that from a baby because the baby tends to be pretty spastic. But that baby has botulism, flaccid paralysis. So the slides that you're talking about are something like this here. These individuals, they have problems here with muscle contraction. In fact, the muscles are contracting too much. Like in this case, this is called cervical dystonia. Here's a person with the wrist is spastic because you have constant contraction. It's like this, right? What if I can relax the muscle like this now? Well, I can use botulism toxin. It's called a type A toxin to actually to remove this condition here. So basically, you give this individual Botox, all right? And then now you relieve that spasm. So is that person going to have spasms later on? Yeah, when the toxin is degraded and removed from the system, then they're going to have spasticity again. Then you give another shot of botulism toxin. What Botox is most known for, of course, is this here. And it's too bad this is something aesthetic. It's not medical because people want to look cool. you get a lot of wrinkles when you smile a lot. All right, but don't stop smiling, and it's a good thing in life. But continuous smiling creates wrinkles. And of course, if you smiling requires skeletal muscle contraction. So if you use Botox, which is the botulism toxin, basically you stop that contraction and you reduce wrinkles. All right. So these conditions, just to be clear, you're using the toxin to eliminate the condition that you see here. Does that make sense?
Yeah, so Botox is like a positive application of botulism.
Yeah, in fact, well, that's more aesthetic. That could be positive. This is just for looks. But the positive one, from my perspective, would be something like this.
Oh, yeah, I mean, like
that.
to eliminate the spasms and all.
Exactly.
Okay, thank you.
All right. All right. Other questions?
Yeah, Dr. Bideshi, could you explain the urease test again?
Yeah, okay. So this one, that urea, is a very important enzyme. So let me take you back to the slide. All right, and it's important that we get this one. All right, so we're looking at peptic ulcers caused by Helicobacter pylori. So this peptic refers to the gastric, or peptic refers to the stomach. All right. So here's the condition this organism causes. Lots of ulcers in here. I mean, this is a small area in the stomach. All right. But you see tons of ulcers here. So this organism is causing that. So the question is, why is it doing this? Most organisms, so here's a bacteria. You have bacterial cells. They end up in the stomach. Most of the time, they're degraded because the acid is too high. I mean, it's pretty high acidic content. So tons of protons around there, you just destroy these organisms. So most bacteria would die in the stomach. But this one has devised a pretty cool strategy. All right. So here's what it does. It produces an enzyme. So this is pylori. This is the bacterium here. All right. It gets into the stomach. And as soon as it gets into the stomach, it starts producing this enzyme here. That's called urease. Now that's pretty cool for this organism, because here's what urease does. It converts something we make, it's called urea, into ammonia and carbon dioxide. Ammonia is a base, a strong base. So this organism, let's just say this is producing ammonia right here. It's going to neutralize the acid content. It's going to make it pH like pH 5 or 6 or 7. It's not that acidic anymore. This is going to allow the organism enough time to penetrate into tissues. All right? So where it's not exposed to acids anymore. Hopefully that made sense to you.
Yeah, I was just actually wondering too about the test, like the urease test.
Oh, the urease test? All right. So in this case, you use a biopsy. So you get tissues from the stomach itself. So you take this huge endoscope, well, this little tube. It's called an endoscope. There's a camera there, so you can take a picture. You can find out where things are. And then let's just say the ulcer is here. You actually cut a piece of tissue, right? And then you put that tissue in this little tube. So this little tube has urea in there. If the bacteria is present, it's going to produce urease, and urea is going to convert urea to carbon dioxide and ammonia. Of course, ammonia is a base. In this case, we have a dye. That dye is yellow at neutral pH. When you produce a lot of ammonia, it's going to become basic. And that change in pH actually changes the color of the dye from yellow to red. All right, so this would be a positive test. And by the way, I've seen this before many times. In about 4 hours, this test is positive. Does that make sense?
Yeah, thank you.
Excellent. All right. All right, guys, study hard. We have that quiz coming up on Monday. I do want to lecture, so we start chapter 13, and then I'm going to leave a little room for a discussion. Maybe you have questions regarding the exam on Wednesday. All right. So be sure that you log on time. I want to say this again. Last time I looked at the stats, people were logging on after the expired time. So as I mentioned in my email, I expanded the time 10 minutes before and 10 minutes after. So basically, if you log on like maybe even say 2:35 or something, you can still take that exam. All right. That quiz. I'm sorry.
Dr. Bideshi.
Yeah.
So the quiz on Monday is just on chapter 12, right?
That's right. Yeah.
And then we have an exam next week as well? Or is
Well, yeah, your exam is next Wednesday. And this is on chapter 11 and 12.
Okay, thank you.
All right? Okay, good. Okay, guys, study hard, and I'll see you guys on Monday. Take care.